This is my audience. My name is Megan Dressler, and I'll be providing you information about postpartum hemorrhage. Postpartum hemorrhage is a major cause of maternal mortality and morbidity worldwide, according to Biomed Central. Postpartum hemorrhage is known as excessive bleeding after childbirth, more specifically defined by the Journal of Maternal and Fetal and Neonatal Medicine as blood loss greater than or equal to 500 milliliters after a vaginal delivery or 1,000 milliliters after a cesarean delivery. Postpartum hemorrhage can be associated with many risk factors, and there are underlying diseases and illnesses which are shown to increase the chances of experiencing excessive blood loss after delivery. There's no way to predict with certainty whether or not someone will experience excessive blood loss after birth. That's why careful assessment by nursing and nursing staff is crucial and plays a pivotal role in preventing and decreasing the severity of postpartum hemorrhage. There are many causes that can be associated with postpartum hemorrhage. During pregnancy, the placenta is attached to the uterine wall, and after delivery, the placenta detaches from the uterine wall, and the blood vessels that previously supplied the placenta with blood and oxygen for the baby due to the intricate muscle fibers of the uterine muscles, they act as a clamp to clamp down and stop the bleeding into the uterus after delivery. Uterine atony is when uterine muscles fail to contract firmly, and that happens to be the most common cause of excessive bleeding after childbirth. This allows for the uterus to fill with blood and blood clots, leading to postpartum hemorrhage, or other causes of postpartum hemorrhage are lesions in the birth canal, uterine rupture, and retained placental tissue or bleeding disorders, according to the Journal of Clinical Nursing. There are common risk factors that are associated with postpartum hemorrhage that should be considered when evaluating a patient. It is difficult to predict before delivery if a mother will experience excessive bleeding after childbirth because there are no specific lab tests that can tell you whether or not you will experience hemorrhaging. Unless there's a previous coagulopathy issue that is known, there's no test that can tell you whether or not someone might experience excessive blood loss. However, because there's no test, the best way to predict whether a mother will experience postpartum hemorrhage is a detailed history and a detailed description on past deliveries. The Journal of Clinical Nursing states postpartum hemorrhage risk factors include a history of postpartum bleeding, complications in the third stage of labor in previous pregnancies, placenta accreta, multiparity, twin pregnancies, macrosomia, maternal coagulopathy, preeclampsia and eclampsia, the use of oxytocin in delivery, induction of labor, precipitous labor, instrumented delivery, postpartum fever, prolonged rupture of membranes, they all have to be considered for postpartum hemorrhage. Although there are common risk factors, it is still common for women to experience postpartum hemorrhage without any known risk factors. Although there's no specific test to determine whether someone will experience postpartum hemorrhage, there are specific identified diseases, more specifically bleeding disorders, that are considered factors that increase the risk. Inherited bleeding disorders, including von Willebrand disease, carriers of hemophilia, and severe platelet function defects are shown to place women at an increased risk for experiencing postpartum hemorrhage. According to the Journal of Evaluation and Management of Postpartum Hemorrhage, women with von Willebrand disease had almost a 5-fold greater risk of being transfused. The risk of postpartum hemorrhage in carriers of hemophilia is correlated with plasma clotting factor levels. Women with Glanzmann thrombocythemia, primary and secondary postpartum hemorrhage, was seen in 34 to 24% of pregnancies. Prevention is key. Active management in the third stage of labor are known to be key in preventing postpartum hemorrhage to progressing into shock and even death. With active management, close monitoring in the third stage of labor, the incidence and severity of postpartum hemorrhage is reduced significantly. Active management includes the following interventions: administration of uterotonics after birth, umbilical cord traction, and uterine massage after delivery of the placenta. This is according to the Journal of Clinical Nursing. The most common and well-known uterotonic is oxytocin, which is commonly used to induce labor but also used after labor. Uterotonics induce uterine contractions and is the first step in active management and is the administration of oxytocin right after birth. Once the placenta is expelled during the uterine massage is performed. This helps to expel blood clots and expel excessive blood and also stimulates uterine contractions. According to the Journal of Clinical Nursing, to ensure that the uterus does not relax after the massage, uteral palpation should be performed every 15 minutes after delivery. Again, nursing assessment and intervention plays a critical role in preventing hemorrhage. In efforts to prevent excessive bleeding, it is important to maintain good bladder tone, good uterine tone, and preventing bladder distension. A perineal pad should be placed under a mom, and if the perineal pad is saturated in 15 minutes or less, or pooling of blood under the buttocks is an indication of excessive blood loss requiring immediate intervention and notification of the primary care provider found in the Book of Maternal Child Care Nursing. Vital signs should be monitored very closely after the observation of excessive blood loss. Due to compensation mechanisms, a mother can lose up to 30 to 40% of her blood volume before noticing a drop in blood pressure. This is found in the Maternal Child Care Nursing. Nurses should also have uterotonics as ordered, administer oxygen, and tilt the woman to her side. This is known to help prevent hemorrhage as found in maternal child care nursing. To conclude, postpartum hemorrhage is a common complication in labor and delivery, and if not prepared for, can be life-threatening. Recognizing common risk factors, underlying diseases, is crucial when planning the care of a laboring patient and the care postpartum. Postpartum can lead to severe blood loss, hypovolemia, shock, and death. Assessment of blood and blood loss is crucial and plays a pivotal role in preventing hemorrhage. Nurses and physicians working together and maintaining education and risk factors can help to decrease the number of occurrences of postpartum hemorrhage.